Okay, let's unpack this. We are diving deep today into a topic that can feel, well, pretty complex, even for those of us working with dogs regularly. Canine prostatic disease.
Mhm.
And specifically, we're looking at it through the lens of intact breeding males where these health issues bring, a whole extra set of considerations. We've got a really detailed source guiding us today, packed with the specifics.
That's right. And our mission with this deep dive is really to act as your guides through that material. We're
Right.
going to try and cut through the density, pull out the most important nuggets of knowledge,
Yeah.
and make sure you walk away understanding what these prostatic conditions actually are, how they show up, and crucially, what the practical options are, especially when a dog's breeding future is on the line.
Because the signs can look incredibly similar from the outside, maybe a little blood, some difficulty pooping perhaps, but knowing exactly which problem is going on makes all the difference in the world for treatment and, well, the outcome. We'll cover the four main categories. The incredibly common age-related enlargement, the frustrating infections, those fluid-filled cysts, and the one we all worry about, cancer.
And understanding those subtle differences is just key to making the right diagnostic moves and ultimately choosing the most effective treatment plan.
So let's start at the very beginning. The prostate gland itself. For those who might not work with anatomy every single day, what's its basic job in a male dog?
It's fascinating, really, because it's the only accessory sex gland that dogs have. Its main role is to produce fluid that contributes to semen.
Okay.
It's positioned right around the urethra, where the urine leaves the bladder, and it's actually quite accessible. Vets can easily feel it during a rectal exam.
Right. What does it feel like?
It usually feels like a bilobed, sort of oval-shaped structure.
Okay. And how does this little gland decide to grow? Is it just like part of growing up?
Well, it's heavily influenced by hormones, particularly testosterone.
Yeah.
Inside the prostate, there's an enzyme called 5-alpha reductase.
Mhm.
Think of this enzyme as a converter. It takes the dog's testosterone and turns it into a much more potent version called DHT, dihydrotestosterone.
Ah, okay.
It's that DHT that is the primary driver stimulating the prostate gland's growth throughout the dog's life.
Ah, the hormone connection is key. Which brings us nicely to the one most people have likely heard of, and certainly the most common issue. Benign prostatic hyperplasia, or BPH.
Exactly. This is fundamentally a normal, age-related enlargement of the prostate gland. It's dependent on those hormonal signals we just talked about.
Right.
As dogs get older, this enlargement is a predictable outcome. And over time, it can even develop small cysts within the gland itself.
And the source gives some pretty striking numbers on how common this actually is, right?
They really do. It's incredibly prevalent in intact males. By the age of 5, roughly half, 50%, of intact male dogs have microscopic evidence of BPH.
Wow.
And by age 9, it's over 95%. So if you have an older, intact male dog, you can pretty much assume his prostate is enlarged due to BPH.
Over 95% by age 9. That's almost universal. So the enlargement itself is well expected. What are the actual signs a listener might see?
Often, the signs are minimal or even completely absent. You might not notice anything.
Really?
Yeah. When they do show up, the most common are seeing blood in the urine, what vets call hematuria, or blood in the semen, which is hemospermia.
Okay.
This enlargement also makes the prostate more vulnerable, sort of sets the stage for developing infections down the road.
So BPH itself might not be a huge problem symptom-wise, but it can lead to others. When a vet feels the prostate during an exam, what does BPH typically feel like?
Typically, it feels larger than you expect for the dog size, but it's symmetrically enlarged, meaning both sides feel equally big, and it's generally non-painful when palpated.
Non-painful, that's key.
Yes. Routine lab work is often normal, maybe aside from showing red blood cells from the hematuria. Ultrasound is a great tool here, confirms the size, and usually shows the internal tissue structure is still quite uniform.
All right, so BPH is common, usually non-painful unless it gets complicated, and often presents with just blood. What's the treatment, especially if this is a valuable breeding dog?
Well, the definitive cure for BPH is castration. Removing the testicles eliminates the source of testosterone, and therefore the DHT stimulation.
Right.
The prostate will shrink significantly over a few months, but as you said, for a breeding dog, that's usually not the desired path.
Exactly. We need to preserve that breeding capability if possible. Is there a medical option?
Absolutely. There's a medication called finasteride. This drug specifically targets that 5-alpha reductase enzyme we talked about earlier.
The converter enzyme.
Precisely. By inhibiting it, It prevents the conversion of testosterone to DHT within the prostate tissue. This leads to a significant reduction in prostate size, which helps reduce those clinical signs like straining or bleeding.
And how is finasteride typically used in these breeding dogs? Is it long-term?
The source notes is primarily used temporarily, often specifically before collecting semen for freezing.
Ah, okay.
It shrinks the prostate to make collection easier and potentially improve semen quality by reducing any inflammation or blood contamination.
Makes sense.
But it's important for you to know that if you stop the finasteride, the prostate will usually return to its pre-treatment size within about 8 weeks or so.
Right, because the underlying hormones are still there.
Exactly. Yeah. So it's really a management tool for active breeding periods, not a permanent fix unless it's eventually followed by castration once the dog's breeding career is over.
Got it. So BPH, incredibly common, manageable with medical options for breeding dogs, but not usually painful unless something else develops. And that something else is often infection, right? Let's talk about prostatitis and prostatic abscesses.
Yeah, these are infections or inflammation of the prostate gland. Prostatic abscesses are essentially large pockets of pus that form within the prostate, usually as a complication of a chronic, maybe untreated infection.
Nasty. What kind of bugs usually cause these infections?
Most are bacterial, typically ascending, sort of tracking up from the urinary tract. Common culprits include E. coli, Proteus, strep, and staph.
Okay.
But it's crucial to remember others, particularly for breeding dogs like Brucella canis.
Oh, definitely.
And less commonly, you can even see fungal infections like blastomyces or cryptococcus.
How frequently are these infections seen? Are they rare?
No, prostatitis is considered common. And our source specifically points out an interesting link. About 40% of dogs diagnosed with prostatic cysts also have a concurrent infection going on.
So the presence of other prostate issues seems to make infection more likely. And age-wise, does it affect younger dogs?
While any age can technically be affected, it's more frequently seen in dogs over 6 years old.
The signs must be quite different from simple BPH, right? Especially if there's an active infection.
Definitely. In acute prostatitis, meaning a sudden severe infection, the dog is usually systemically ill. They feel really unwell. You'll see signs like vomiting, fever, a poor appetite. They might walk stiffly because of the pain. You'll often see pus in the urine that's pyuria.
And chronic, is that different?
Chronic prostatitis, on the other hand, is often more subtle, or it might seem to come and go. It might just look like recurrent urinary tract infections, maybe a persistent stiff gait, and it can certainly impact fertility.
Right. And on physical exam, how would a painful infected prostate feel compared to that non-painful BPH?
This is a really key difference. In acute cases, you might find the dog has a fever, is dehydrated, and their abdomen is very painful to touch, especially near the prostate area.
Yeah.
The prostate itself can range from normal size to enlarged, but it's often asymmetrical, feeling uneven, and it is typically very painful on palpation.
Very painful. Got it.
In chronic cases, though, the prostate might not be painful, interestingly. It could even feel symmetrical, but it might feel firm or maybe have soft, fluctuating areas if there are cysts involved.
Diagnosis sounds absolutely critical here, especially to identify the specific bacteria causing the trouble.
Absolutely. Lab work will often show signs of infection throughout the body, like an increase in white blood cells, specifically neutrophils. You'll likely find pus and bacteria in the urine sample. But the definitive diagnosis, and importantly, the guide for treatment, comes from culture. The source details methods like culturing the third fraction of the ejaculate.
The last part of the semen sample.
Exactly. Or getting a sample directly from the prostate via fine needle aspirate. They also mention a clever technique of taking paired cultures, one from the urethra and one from seminal fluid, and comparing the bacterial counts.
How does that help?
Well, a significantly higher count in the seminal fluid sample strongly points to the prostate as the source of infection, rather than just contamination picked up from the urethra.
Clever. And imaging.
Ultrasound is also vital. It helps visualize changes in the prostate tissue structure or identify those pockets of pus, the abscesses.
Okay, so we've identified the bacteria with a culture. What's the treatment plan for prostatitis? Sounds serious.
It requires long-term antibiotics, and crucially, the choice of antibiotic must be guided by those culture and sensitivity results. You need the right drug for the specific bug.
Right.
For acute cases, where the blood-prostate barrier is essentially open due to all the inflammation, you need a minimum of 3 weeks of treatment.
Okay.
For chronic infections, that barrier is typically intact, which means you need specific antibiotics that can actually cross into the prostate tissue effectively.
Which ones can do that?
The source lists examples like enrofloxacin, trimethoprim sulfa, chloramphenicol, erythromycin, and doxycycline. Treatment for chronic prostatitis typically lasts a minimum of 6 weeks.
6 weeks minimum. Wow. And I assume you need to make absolutely sure the infection is completely gone.
Oh, absolutely. Repeat cultures are essential, both during and after treatment, to confirm that the bacteria have been completely cleared. This is vital to prevent recurrence, especially in those tricky chronic cases.
Makes sense.
And for difficult or recurrent prostatitis, castration is often recommended because the smaller, hormonally inactive prostate is just far less susceptible to ongoing infection.
So infections are painful, serious, often requiring long-term specific antibiotics based on culture. Let's shift gears slightly and move on to another potential issue: prostatic cysts.
Right. These are basically fluid-filled structures associated with the prostate. They can be located within the prostate gland itself, often called retention cysts.
Retention cysts, why do they form?
They can happen if prostatic ducts get blocked, maybe secondary to BPH changes. Or cysts can be attached externally to the prostate, sometimes getting quite large. Those are known as paraprostatic cysts.
And what causes these cysts to form? Is it just aging?
Well, while some are definitely related to BPH and aging, others, particularly those retention cysts, can be linked to estrogen exposure.
Estrogen in a male dog.
Yeah, for instance, if a dog has a Sertoli cell tumor in the testicle that's producing excessive estrogen, that hormone can cause changes in the prostate tissue that lead to cyst formation.
It's interesting. How common are cysts overall?
Our source puts the prevalence around 14%, so not as common as BPH, but certainly seen.
And age, mostly older dogs.
Yes, they're more commonly seen in older dogs, typically after the age of 8.
Do the signs look different with a cyst compared to BPH or infection?
Not necessarily. That's the tricky part. The signs can be very similar to BPH, things like discharge from the penis or difficulty defecating because the size of the prostate or cyst is pressing on the rectum.
Okay.
Now, if a cyst becomes infected, then you'll see signs of prostatitis, just like we discussed.
Right, it gets complicated.
Exactly. And importantly, if the cysts are caused by that estrogen exposure from a tumor, you might see external signs of feminization, like enlarged mammary glands or a pendulous prepuce.
That's a really important clue for the underlying cause. On physical exam, what would the vet feel with a cyst?
You'll typically feel an enlarged prostate, similar perhaps to BPH, but with distinct fluctuant or sort of fluidy, soft areas within or around it. Very large paraprostatic cysts can sometimes be so big they're actually palpable as a mass in the dog's abdomen.
Wow.
And again, if estrogen is the root cause, those signs of feminization might be present.
What's the approach to treating prostatic cysts then?
Castration is generally the treatment of choice. Removing the hormonal influence often causes the cysts to shrink or disappear, particularly the smaller retention cysts linked to BPH.
Okay.
If BPH is significantly contributing, finasteride might be used temporarily, perhaps alongside planning for castration. If the cyst is due to estrogen production from a tumor, removing that tumor is essential.
What about really big cysts?
For large solitary cysts, surgery is often needed in addition to castration. The source mentions a procedure called marsupialization.
Marsupialization.
Yeah, where they essentially create a permanent opening from the cyst to drain, usually into the abdomen where the fluid can be absorbed. Aspiration, just draining the fluid with a needle, is generally not curative on its own.
Doesn't fix the problem long term.
Right, the fluid usually comes back.
Yeah.
But it is a good idea to collect that fluid when you can
Yeah.
and culture it to check for any underlying infection.
Good point. So cysts add another layer, potentially linked to BPH or tumors, and often require castration, maybe even surgery. Now, let's address the one that carries the most serious weight: prostatic neoplasia or cancer.
Yes. This is the significant concern, obviously. The vast majority are adenocarcinomas, meaning they arise from the actual glandular tissue of the prostate.
Okay.
Another important one to be aware of is transitional cell carcinoma, or TCC, which typically starts in the urethra but then invades the prostate secondarily.
And a really critical point from the source, which might surprise some listeners: BPH, that common enlargement, is not a risk factor for prostatic cancer in dogs.
That is a fundamental distinction, and it's crucial. Unlike BPH, the development of prostatic tumors is not dependent on androgens, those male hormones.
So hormones aren't driving the cancer.
Correct. This is why castration is not protective against prostatic cancer. The tumor types are simply different biologically and driven by different factors we don't fully understand yet.
That's so important to clarify. Thankfully, the prevalence is relatively low compared to BPH, isn't it?
Yes, it is. In the general dog population, it's quite rare, only about 0.2 to 0.6%. But
Hmm.
for dogs presenting with signs of prostatic disease, it becomes a more significant piece of the puzzle, representing about 5 to 7% of those cases that show up at the vet clinic with prostate trouble.
Okay, still relatively uncommon overall, but definitely something to consider in a sick older dog, and age is a factor.
Yes, the mean age for diagnosis is around 10 years old.
The source mentioned that cancer is often detected late. What do those later stage signs typically look like?
Yeah, because it's often detected once it's already spread or metastasized. The signs can be quite severe and sometimes nonspecific initially, then they progress. You might see generalized poor condition, weight loss, emaciation, significant difficulty or pain when trying to defecate. That's dyschezia problems with the hind limbs, like weakness or lameness, and signs of pain in the lower back or pelvis.
And those signs are often because it's spread.
Often, yes, due to the tumor invading local tissues or, sadly, spreading to bones, which it tends to do.
On exam, what would a cancerous prostate feel like compared to the others?
Another key difference, usually. The prostate will likely feel large, but it's typically very asymmetrical, feeling uneven and irregular in shape and texture. And like acute prostatitis, it's usually very painful when palpated rectally or through the abdomen.
Painful and irregular.
Yes. You might also be able to feel an abdominal mass associated with enlarged lymph nodes nearby, which is a common site for the cancer to spread to first.
Diagnosis sounds challenging because, again, some signs overlap with infection or even severe BPH with cysts.
It absolutely is. While basic lab work might show non-specific signs of inflammation or infection, if those are secondary complications, or sometimes an elevated liver enzyme called alkaline phosphatase, ALP, you often don't see definitive cancer cells in routine urine sediment.
So imaging is critical.
Imaging is paramount. Ultrasound shows the crucial internal architecture, that asymmetry, irregularity, and it can help assess the regional lymph nodes for signs of spread. Radiography or X-rays are also essential,
Why X-rays specifically?
especially for checking for bone metastasis, which is unfortunately common with adenocarcinoma. It often affects the lumbar spine or the pelvis.
And the source gives a very specific and actually quite useful radiology tip regarding this.
Yes, they do. They highlight that in an intact male dog with an enlarged prostate, if there is no mineralization, meaning no little calcium specks visible on the X-ray within the prostate gland itself.
Okay.
This has a very high negative predictive value, 96% for neoplasia.
So no calcium spots on X-ray in an enlarged prostate of an intact dog makes cancer very unlikely.
Exactly. It's a huge piece of information for helping to rule it out early in the diagnostic process. Doesn't completely exclude it, but makes it much less probable.
That's incredibly helpful clinically, but ultimately you need confirmation, right? You need to know for sure.
For a definitive diagnosis, yes, you generally need cytology or biopsy. This means either a fine needle aspirate, where you collect cells with a needle, or an ultrasound-guided biopsy to get a small tissue sample.
Are there risks with that?
Our source does note that aspiration carries a small risk of spreading infection or potentially seeding tumor cells along the needle track, though it's often a necessary diagnostic step.
Right.
And just like with suspected infection, you should always culture the urine to check for a concurrent UTI, as they're common with any kind of prostate issue, including cancer, and need to be managed.
Given how late it's often detected and the high potential for spread, what are the treatment options for prostatic neoplasia? It sounds grim.
Unfortunately, because metastasis is so common by the time of diagnosis, the prognosis is typically poor. Treatment really focuses on palliation, managing the symptoms, and trying to slow the progression, maybe improve quality of life, rather than achieving a cure.
So what does palliative care involve?
It usually involves chemotherapy, the specific drugs, depending on the tumor type, whether it's an adenocarcinoma or a TCC. Often a trial with an NSAID like piroxicam is used, as they can have some direct anti-tumor effects on these types of cancers, surprisingly.
And managing symptoms.
Yes, supportive care is also critical, focusing on pain control with analgesics and helping the dog defecate more comfortably, maybe using stool softeners.
It really brings home the point you made right at the start about how much the underlying cause matters. While signs like difficulty defecating, discharge, urinary issues, maybe a stiff gait can overlap across all these conditions.
Exactly. That's why a thorough workup is so essential. You can't just rely on the clinical signs alone. It's that combination of a good physical exam, carefully interpreting lab work and urine findings, using advanced imaging like ultrasound and radiography, getting those specific cultures when needed,
Mm-hmm.
and sometimes requiring cytology or biopsy. Those are the steps needed to accurately differentiate between common, BPH, a treatable infection, a cyst, or, thankfully less often, cancer. And each one leads you down a completely different treatment path and gives a different outlook.
And just circling back for our listeners with breeding programs, are there specific points related to management and monitoring that the source really emphasizes for them?
Absolutely. For any breeding animals, regular testing for Burchella canis is highlighted as being very important, not just for general reproductive health, but because it can specifically cause prostatitis.
Good reminder. What else?
The source also strongly advises proactive semen freezing at a younger age, ideally before any prostatic disease, even just common BPH, starts to develop and potentially impact semen quality or the ease of collection.
That's really practical advice. Get the semen banked before issues potentially arise. And if a dog has had a prostate issue, say prostatitis, how should they be monitored, especially if they might return to breeding?
Monitoring is absolutely key. If they've had an infection, repeat cultures are needed to ensure it's truly, completely cleared before you even consider them for breeding again.
Makes sense.
A full semen evaluation should probably be performed approximately 70 days. That's about one sperm cycle after recovery from any significant prostatic illness if you plan to use them for breeding.
Okay.
And follow-up ultrasound examinations can be really useful too, just to monitor the prostate's response to treatment and check for any recurrence or development of new issues like cysts.
And just to quickly summarize the typical prognosis again for these different conditions we've covered.
Sure. For BPH, the prognosis is generally excellent with treatment, whether it's finasteride for breeding dogs or castration. Chronic prostatitis can be more challenging to manage long-term medically, sometimes requiring castration for a definitive resolution of recurring issues.
Yep.
And unfortunately, as we discussed, prostatic neoplasia typically carries a poor prognosis due to the high likelihood of metastasis by the time it's diagnosed.
So the big takeaway from this deep dive really seems to be that while a dog showing symptoms like straining or bloody discharge might have you worried about one specific thing, the reality is there's a whole spectrum of potential prostate problems,
That's right.
ranging from the almost guaranteed manageable age-related BPH to treatable infections to cysts that often resolve well with castration, all the way to the much more serious but thankfully less common cancers.
And for those of you managing breeding lines, understanding these distinctions is what allows for strategic medical management with drugs like finasteride, taking proactive steps like semen freezing, and maintaining vigilance for specific risks like brucella. It helps preserve reproductive potential where possible, while also recognizing the signs of more serious diseases like cancer that aren't just hormone-related.
Considering how devastating prostatic neoplasia can be and how late it's often found, it really makes you wonder, doesn't it? What future breakthroughs might lead to earlier, maybe less invasive ways to screen for or detect these rare but serious cancers before they've spread?
That's the hope, isn't it? Better screening.
Or, perhaps more immediately, what does this detailed understanding mean for how we proactively approach the health of all older, intact male dogs, regardless of whether they're being bred or not? Just something for you all to think about as you process this information.